Kia ora koutou katoa. Welcome again to the Ministry of Health. Thank you for including the sign language interpreter in your picture. I have with me, should be familiar to you, Dr. McElnay. She is the Director of Public Health, and she's going to make some comments in particular about the Diamond Princess. I'd like to just start, as I do each day, with reaffirming that we have no confirmed or suspected cases at the moment in New Zealand. Suspected or confirmed cases of COVID-19, of course. There has been a lot of interest in whangaparaoa today, and you will have seen the messages of people who have been leaving. We have a sheet here to hand out of some of the feedback we've received from those who have been in the centre. Two things stood out for me. First of all, someone commented that the Wi-Fi was slow, but that was sorted out after 2 days. And someone lamented the fact there was no beer. But other than that, the feedback, as you'll see, was very affirming and positive about the experience people had there, which is great because we were looking to look after these people. They were not prisoners. They were there voluntarily, and I'm delighted that they all stayed through and that they had a good experience there and that we can now send them home well. So saying, at the final check that everybody received, there was one person who was displaying mild symptoms. That person and the person they have been sharing a camper van with are still there, and that person who had the mild symptoms has been tested for the coronavirus, and we will have the results later today. We're not expecting these to be positive. As I've said before, we've had a very low bar for testing, and the purpose of these final assessments and checks was to pick up any symptoms and to take a very precautionary approach to testing if anyone had symptoms. As I say, we will let you know and provide the outcome of that test later. There are many organisations I can, and some that I will thank. There's been a huge effort mounted over the last 2.5 weeks to both prepare and then run the centre there for the people in quarantine. Police, New Zealand Defence Force, medical workers, Red Cross, Ministry of Foreign Affairs and Trade, interpreters, and many other people, and of course many from the local community and beyond who have been very supportive and have actually provided everything from toys to food to the people there to help support their stay and ensure it was as enjoyable as possible. As you also know, we are planning to keep the centre open for a little longer because it is to whangaparaoa that the 8 people who are returning from the Diamond Princess cruise ship will be taken to complete their 14 days of quarantine. And the planning is underway there to ensure that they are fit and healthy and stay safe, and also that we protect the rest of the community in case one of those people has been exposed and may be incubating COVID-19. I want to hand over to Dr. McElnay. Caroline's been in very regular contact with her Australian counterparts about the next steps and about what lay behind our decision to bring these people back from Japan to Darwin and then back to Auckland and up to Whangaparaoa. So Caroline, over to you.
Thanks, Ashley. So over the weekend, I've been in regular communication with the Australian epidemiologists who've been on the ground, as well as epidemiologists from the US and from Canada. And internationally, there's been an assessment that during the quarantine period, the passengers may have continued to be exposed to the virus during that quarantine period on the ship. And that's why we're recommending a further quarantine period from when they leave the ship. And as you know, we have 8 passengers who will be leaving Japan tomorrow morning. I understand that that's estimated to be 5 o'clock in the morning, but there's been some delays just with processing flights already. So we're aiming for 5 o'clock in the morning. They will go to Darwin, and then when they land in Darwin, they'll be transferred to another flight to Auckland. So that will be arriving tomorrow night at this stage into Auckland. We have a New Zealand paramedic who is leaving this afternoon from here to travel to Darwin to get ready, to get set up to meet the 8 New Zealanders off the flight into Darwin, and he will be assessing them, and we will be taking the same precautions and the infection control procedures that we took with the flight that came from Wuhan. So we're completely replicating those procedures, which were very successful. And anyone who is symptomatic in Japan, we've been advised by the Japanese authorities and by the Australian authorities, will not be able to get on the plane. They are having testing done, and if the tests are positive, they will not be able to get on the plane. They will have to stay in Japan. And the same if when they arrive in Darwin, we're just clarifying with the Australian authorities what will happen on the ground in Darwin before they come back to New Zealand. But our understanding and expectation is, again, anyone who is symptomatic on arrival in Darwin would not be able to come on the plane back to New Zealand. So at this stage, we're planning for 8 New Zealanders to come back tomorrow night, and they will be taken to the Whangaparoa Reception Centre, which will have got ready for them for tomorrow night. And the plan is that they will then be offered the chance to stay there for 14 days to complete their quarantine period. We do have other New Zealanders who were on the cruise ship who have not returned. The information that we have about them is that we have 2 New Zealanders who were in hospital and they are well, and they have a family member with them who's also staying with them in hospital. They will then be cleared when they're discharged from hospital as completely clear to travel. We have 2 other New Zealanders who have not come on the flight, and they have opted to go elsewhere for 14 days and see out their quarantine period elsewhere. And so they won't need to be on the flight. And my understanding is the 3rd New Zealander is in a similar situation, is also travelling elsewhere. So this is a much smaller group than what we had before at the Whangaparoa Reception Centre, and the plan is for a very similar approach where they'll have daily health checks and our full support. Thank you.
Thanks, Caroline, and we'll come to questions shortly, and you may have some for Caroline. Just a quick comment on the border restrictions. You'll recall that the current border restrictions are in place till midnight next Monday, and we are at the moment in the process of extending those border restrictions to include any person who was on the Diamond Princess for a 14-day period. So that 14 days will extend beyond next Monday, obviously, but that is to ensure that no one who has been on that ship, other than the 8 that we are bringing back with a carefully managed flight and then going into quarantine, nobody else from that ship will be able to come into New Zealand for the next 14 days. The other cruise ship of interest is the Westerdam, and just an update on that. You'll recall this ship is actually docked in Cambodia and has had at least 1 confirmed case of COVID-19 identified after most passengers had dispersed from the ship. There were 16 New Zealanders on board, and again, we're putting precautions in place. I mentioned yesterday that 5 had returned and they are in self-isolation. This is a family. 2 of those people were symptomatic yesterday. They were tested. The tests were negative, remembering that we're only testing people who are symptomatic. And the family remains in self-isolation. And there is also another group of 8 that have travelled back, arrived today, have been met and checked by public health staff, are now going into self-isolation for 14 days as well, with a little bit more intense contact. So the public health unit will be in daily contact with those people who are in self-isolation. So the people coming off the Westerdam ship, by no means in the same category as those coming off the Diamond Princess. I would say they're more akin to people returning from mainland China. At the moment, there is still only the 1 confirmed case from that ship, the Westerdam, but we're taking a cautious approach while that situation evolves. What else might I say? Oh, perhaps I can just finish. Last evening, I was on a webinar with over 300 GPs from around the country for an hour or so. Really good opportunity to talk with the health professionals and their teams who will be essentially at the front line of perhaps identifying and or testing people who might fit the case definition for COVID-19, recalling that we don't have any suspected cases at the moment. We were able to canvass and cover a number of questions they had. use the questions and information they were providing to support our planning, and in particular reassure them that we will ensure they have access to personal protective equipment, so that if they are seeing, assessing and taking samples from people in their practices, they will have the appropriate equipment. So that is well underway, and we're working with our DHBs and primary health organisations to ensure that that PPE is distributed. I think I'll pause there, and happy to take any questions. The tricky ones, of course, Caroline will step up for. Thank you.
That two people had mild symptoms, which could be coronavirus. Does that show that the quarantine period is too short? Because they were all tested anyway.
So just recalling, the only people who have been tested in Whangaparaoa are those who have displayed any respiratory symptoms while they were there, with a very low bar. And this was the occasion this time. So the person who's been tested coming out of Whangaparaoa did not fit the case definition, but we are taking a very precautionary approach there, and fully expecting that test will be negative, but again, a cautious approach. Yeah. Did you want to?
And I just want to pick up on your point, which I think is about the incubation period, and whether we can reliably say that's 14 days. When we've looked at all the cases that have been reported across the world, the median, so 50% are less than this value, the median is about 3 days at the moment, so it usually presents very, very quickly. There was a case study of a large number of cases, and that one study indicated that there were a small number of people that it looked like as if the incubation period might be longer than 14 days, but that they were just outliers. And what WHO has come back and confirmed is that 14 days is the line that we should take as our maximum incubation period. You sometimes can get individuals who react differently, but that would be very unusual, highly unlikely. So that's why we're using 14 days.
And also, just to reiterate, all those people who have gone home have got very clear instructions about what to do if they become unwell. So saying we're not expecting that to happen, and the 14-day incubation period has got built into it a margin of error.
How thorough is the effort to clean the camp ready for the act?
Oh, well advanced, and recalling also that because there have been infection control precautions in place every day, including cleaning every day, this is just a routine clean with disinfectants on hard surfaces, where you're looking for if someone may have sneezed or coughed and virus, if it was there, although we don't have any sense that it was, might have settled on a bench surface. So all those surfaces will be disinfected as per usual cleaning.
What was the feeling from the Bloomfield group as they left today?
Well, I think that's where I'd point you in the direction of some of the comments. And look, I could only imagine it must be a great sense of relief and pleasure to see family members again, and to be heading home back to normal life. It's been quite an ordeal for them, remembering that they were in Wuhan prior to that and under quite a strict sort of lockdown regime there. So I'm sure that the comments will speak for themselves. Any other questions?
We've spoken to some that have come out of quarantine that have expressed a bit of frustration that there aren't wider travel bans and border restrictions as the virus continues to spread around the world. What's your response to that? These are the people who've been in quarantine. Yes,
indeed. And at the moment, our border restrictions are anyone who has been in China or travelled through China within a 14-day period of arriving. If they're not a New Zealander, they can't come into the country. In fact, they can't board a plane to come here. If they're Kiwis, they need to go into self-isolation. China is the only country with a documented community outbreak of this condition. In the other countries, even those that have got quite large numbers of cases, there is not ongoing community transmission. So the risk is very, very low. And at the moment, whilst we're looking at this every day and remember reviewing our border measures and restrictions every 48 hours, at the moment that China is the only country that we believe we need to have those travel restrictions on.
There were some new safe travel advice recommendations released for travel to China and for those in China. You'll explain those?
No, I'm sorry. I haven't seen them, but I'm happy if there's any questions. Perhaps if you want to do a follow-up question, but I haven't seen those because that's Ministry of Foreign Affairs and Trade that runs the Safe Travel website.
That's fine, sorry. And there was a comment in there that said if the situation continues to deteriorate further in China, the ability for the New Zealand Embassy and consults to provide assistance to New Zealand nationals within China may be limited. Are you aware at all if we're trying to pull diplomats out then?
Oh, no, I'm not aware. And of course, that assistance can be from the ground, but also remotely, a lot of the consular assistance. So I'm not aware of any. It's more about restrictions on travel, I think, that are the is what's being pointed to there. Okay.
In hindsight, could you have assisted them to depart earlier so they only had to undergo 1 month of quarantine?
Are you talking about the Wuhan or the people from the ship?
Sure.
Yeah. So you will have seen that was quite fast moving, and it was only towards the end of the 14-day period that the number of cases on board the ship really started to increase, and that raised concerns for a number of countries about whether the quarantine procedures on board were adequate. Prior to that, we had no reason to believe. That's why you've then seen countries, including the US, UK, Canada, ourselves and Australia, intervene to ensure that people could get back to their home country safely and also go into a supervised quarantine.
By leaving them on board longer, are they at higher risk of having contracted the coronavirus?
Well, we have seen that there is quite a high rate of infection on board that ship, and that's why we're putting them in a supervised quarantine situation. I should say we didn't leave them on board there. We were all watching the situation very closely. And when it got to a point that it was clear, and as Caroline said, there was an Australian infectious disease epidemiologist on the ground, and it was on that person's advice that we then made the decision to take up the offer from the Australians to evacuate these people back, and then to send a flight to go and get them from Darwin, bring them here and stand up the Whangaparoa Centre for them. So I think that's a really appropriate and decisive intervention.
So there's nothing to change about the process?
I think we've responded really well, actually, and we've done so in really close discussion with not just Australia. Several of the teleconferences that Caroline was on included 5 countries, so the UK, Canada, USA, Australia and ourselves. So we've been working very closely with all of them.
Those 3 that aren't coming on the flight and got to do isolation, quarantine somewhere else, are you going to make them go into further quarantine when they come back to New Zealand?
Did you want to comment?
If they come back after 14 days, then they'll be fine. We wouldn't have anything more that we require them to do. But if they do come back to New Zealand during the 14-day period, then we'll be able to identify them at the border. And then, yes, we will be giving them advice that they complete the 14 days.
And you said the flight is at 5 a.m. Is that New Zealand time? Or?
Yes, that's New Zealand time.
Do you know where those 3 have gone?
My understanding is that 2 of them have gone to South Korea, and the 3rd, I think, is Hong Kong.
Can I just ask you about the Western Island ship again? You said you're treating those people in the same way as people coming back from mainland China, even though there's been a case on the ship. Why are they not giving health checks at the airport and that sort of thing? What do you feel what you've got in place with the voluntary?
I think the Westerdam situation is quite a different situation, because this was a cruise ship that hadn't been able to dock at several ports and had been cleared and docked at Cambodia. So the passengers, my understanding is the passengers were then cleared to leave the cruise ship in Cambodia, and they've all made their various plans to travel on. It was only when the American woman was identified as she entered Malaysia that indicated, and she's the potential case, that indicated there may actually have been someone who was infected on board. Prior to that point, no one on the cruise ship had been identified as being a potential case.
We do know now, though, that there is a potential case. What safeguards could we put in place?
So just to be clear, we know all the New Zealanders that were on there. In fact, we've got the passenger list for everybody who was on that ship. So those New Zealanders who arrived back today were assessed at the airport. So they weren't just given information, they received a health assessment. They were all then given advice and the expectation to go into self-isolation, and they will be monitored on a daily basis by public health staff.
Could we just have an update, please, on how far through the ministry has gotten with reaching all the people who have travelled back from mainland China since February 3rd? I understand that telehealth service is kind of going to get to as many as possible. What is that figure at now, and how many are still to be contacted,
Sure. I'll give you some updated numbers. I literally got them. That was why I was a couple of minutes late. So to date, what we know is since the 3rd of February, there are 7,924 people, this was as of yesterday, who had travelled in either from China directly or who had been in China within the last 14 days and travelled from somewhere else. So that was just under 8,000. Around 2,670 of those will have finished their 14-day isolation period now. So that leaves about 5,500 who most of whom will be in a still in a self-isolation situation, although some won't be because they may have spent some time out of New Zealand after they left China. And of those, so about 5,500 of those, as at yesterday, end of yesterday, 4,722 people had either registered or or Healthline had been able to contact proactively, and they continue to do so. So, I mean, that's thousands of people who are voluntarily in self-isolation are in contact with Healthline, and we can assume that the balance of those know exactly what the expectation is of them, and either they've determined that they don't have any particular need for support, they've got everything sorted, or they may well not be in self-isolation. We don't know that for sure, but of course the message remains the same. Anyone who has travelled back from China, any Kiwi, who is allowed back into the country is expected to self-isolate for that period. I'm really impressed with the proportion of people not only who are doing it, but who have registered.
What is taking so long to contact those last few people? Is it that they're off the radar kind of thing, or how many staff, ministry staff, telehealth staff are working on this full time? You know?
Well, there are a lot of staff working on it, and partly it's just about matching up the customs data with and getting mobile phone numbers and or emails that they can contact people on. So it's actually quite a manual process. I should say that there is, as I've said, there's a lot of Healthline staff working on this, and one of the things I can say is that they've now got an extra 48 Mandarin-speaking staff who have been onboarded to Healthline to assist with making those calls, because many of these people, whilst they're either New Zealand citizens or permanent residents, their first language is Mandarin, so there's really good access to interpretation to help reach out to these people.
Can the ministry really be confident, though, that there's no cases or suspected cases when there's still this bracket of people, even if it's in the hundreds now, not the thousands, which just have not been even contacted at all? You know?
Well, look, there's a really high level of awareness, and I think of community expectation around that people will do the right thing here. And it's the same with any one of these situations. At the end of the day, the Healthline process is to actually offer support and check on people's wellbeing and welfare. It's not a policing mechanism. So we have to rely on people to do the right thing. What is clear is that most of the people who have come back from China are aware of the obligation, if not all should be aware, and it looks like the vast majority are obliged, fulfilling their obligation. I suspect there will be people in the community who will be aware too of people that have come back from China. We have had no one come to us and say, here is someone who came back from China and is not self-isolating, and I think that speaks for itself.
Just quickly want to go back to that Qantas flight. I understand passengers are going to be screened before they get on, but new research has suggested that might be quite ineffective. What are the chances of coronavirus coming back on that plane?
I'm not sure what the screening that you're referring to is, but certainly everyone who is coming off the ship will be symptom-free, and they will have had a test to see whether they're currently carrying the virus. And that is the best that we can actually do at this stage. That gives us a very strong reassurance that at that point in time, they're not actually carrying the virus. But obviously that's why we need to then monitor them for the next 14 days and do further tests and assessments so that then we can pick up as soon as they do become infected and then manage them accordingly.
But we can't be sure that it's not coming back.
We're doing everything that we can to minimise that risk. One of the issues that we have seen with this ship, that despite being in quarantine, there were ongoing cases that were appearing. So that's why we've worked with the Australians to bring our New Zealanders out of that situation. And that is the good first step, is to remove them from exposure to the virus and then closely monitoring them afterwards.
Is there any thought as to how it is spreading still when they're in quarantine on board the ship? Is this air reticulation or does this virus travel through air conditioning? Is there any thoughts on that?
They're still trying to work out exactly what might be the situation, but all ships are notoriously hard to ensure that all surfaces are kept free of viruses. We've seen that with other outbreaks. When we have influenza outbreaks on a cruise ship, it goes right through the cruise ship. Same with noroviruses. So it's just incredibly difficult environment to really maintain good infection prevention control. And despite the best efforts of the Japanese government in doing that in the cruise ship, I think what we've seen over the weekend is there's been sort of like 2 phases of infection, and it's the second phase that has really made the rest of the countries take their people off the ship, because it's obvious that there's an ongoing exposure.
Or we might be there. Okay, so it just remains me to thank you once again, and as I say, help yourself to a list of quotes from people if you haven't had your own ones that you've gleaned already, and thank you very much for your ongoing interest and support. Kia ora koutou.